Hey everyone, and welcome to The Explainer. Today we're diving into something that is absolutely crucial, yet often completely overlooked. We are decoding the language of medicine. Now, whether you're a patient trying to navigate the system, a healthcare pro, or just someone fascinated by how complex organizations tick, understanding the anatomy of healthcare communication is essential. It's the invisible thread holding the entire medical system together. And as you'll see, mastering this isn't just about sounding smart, it's literally a life-saving tool. But right out of the gate, we need a reality check. 80%. Just let that sink in for a second. Research shows that a whopping 80% of serious unintentional hospital errors are tied directly back to poor coordination or communication. So when things go wrong, it's very rarely a lack of medical skill. It's actually a failure to effectively share information.
To put that into perspective, medical jargon isn't just hospital slang. Up to 98,000 deaths every single year in the U.S. alone are linked to medical miscommunication. That is tens of thousands of lives lost, simply because critical information was misunderstood, assumed, or completely lost in translation. It is literally a matter of life and death.
So, how are we going to fix this? Well, here is our roadmap for today. We're going to move from the micro level all the way to the macro. We'll start with decoding medical terminology, then move to the human connection, documenting patient care, teamwork and handoffs, and finally, tech and telemedicine.
All right, let's jump right into part 1, decoding medical terminology.
So without a shared language, the whole system just collapses. And it all starts with the most vital distinction in medicine, anatomy versus physiology. Think of it like a house. Anatomy is the physical architecture, the wood, the nails, the drywall. Physiology is how that wonderful machine actually runs, the plumbing, the electricity, the heating. Getting this fundamental distinction wrong completely changes the entire treatment plan.
And you know, this incredible precision extends right down to the medications we take. Ever looked at a written prescription and thought it looked like a secret code? Well, it kind of is. It's a highly structured document based on Latin roots, divided into 3 specific parts. First up is the recipe, which is the specific drug and strength to be dispensed. Then comes the signa. Those are the instructions to the patient on how to actually take it. And finally, the subscription, which gives directions to the pharmacist. A pharmacist absolutely has to decode this exact syntax to ensure proper dispensing and avoid dangerous ambiguity. Because one wrong guess, that could lead to a massive overdose.
Okay, moving right along to section 2, the human connection.
Picture a high-stress environment, like a packed ER. Doctors naturally default to rapid-fire, closed-ended questions to gather info quickly. Do you have a headache today? It limits the patient to a simple yes or no. Highly efficient, right? But flipping that to an open-ended question like, how can I help you? Wow, that is a real game changer. It's the true catalyst for patient-centered care because it uncovers the patient's emotional needs, not just their clinical symptoms.
And there is a massive human crisis hidden right behind these communication styles. Let's look at the UK's National Health Service for a second. 8% of the population identifies as non-English or Welsh speakers, and of that group, a staggering 59% struggle to communicate effectively with their doctors. Imagine being in pain and literally not having the shared vocabulary to explain what's wrong. Patients might silently endure terrible side effects simply because language barriers block culturally competent care.
Now, do you remember that shocking 80% statistic about communication errors from earlier? Well, here is one of the absolute best defenses against it. It's called the teach-back method. Instead of just handing you a pill bottle and sending you on your way, a pharmacist or nurse will actively ask you to explain back what they just said. If you can't recall how often to take the medication, the provider immediately knows they need to clarify. It is such a simple, elegant way to ensure total comprehension.
Let's step behind a desk for section 3, documenting patient care.
For institutions that still use handwritten charting, the rules are intensely strict. We're talking rigid protocols. You must use a black ballpoint pen. You can never ever erase a mistake. Actually, if you mess up, you have to scratch it out with a single line so the original text is still totally visible, and then write the correction, the date, and your signature. Why all the fuss? Because these notes are serious legal documents. In cases of clinical negligence, these records have to pinpoint exactly who was present and responsible at any given moment.
Now, of course, today we mostly use electronic patient records, or EPRs. They're everywhere, but they create a very modern dilemma. With an electronic system, it can be really tricky to validate timestamps. Was a note made contemporaneously, meaning the exact moment the patient was seen, or is it typed up hours later, in retrospect? That leaves a ton of room for legal vulnerability. On top of that, you have laws like HIPAA that mandate disclosing only the minimum necessary data. It's a really delicate balancing act, sharing enough information so the medical team can do their job while fiercely protecting your privacy from anyone who doesn't absolutely need to know.
Which brings us seamlessly to Section 4, teamwork and handoffs.
Imagine the pure adrenaline of a hospital ward. Nurses, doctors, and specialists are constantly buzzing around, and care shifts are always changing. This brings us to the handoff. It's that critical moment where patient data is passed like a baton between caregivers. And guys, this is the ultimate danger zone. The vast majority of miscommunication happens right here. In these chaotic, fast-paced environments, even one piece of omitted info equals completely compromised patient safety.
And when an actual emergency strikes, say someone suddenly falls unconscious, communication has to be lightning fast and crystal clear. First rule, assess safety and relocate if you're threatened. But here is the big one. Do not shout general warnings in a shared space. That literally just incites panic. Instead, you have to shout very specific calls to action. Say, help me check on that person, or you in the blue shirt, follow me. Directing the chaos with targeted commands protects everyone and gets organized action happening immediately.
All right, we've made it to our final pillar, Section 5, Tech and Telemedicine.
We are obviously navigating a massive shift toward digital health, but the trade-off here is stark. On one hand, traditional face-to-face interaction allows for full empathy and compassion. You can read a room. On the other hand, digital and text communication is wildly efficient, which is great, but it introduces severe new risks. We're talking data loss, ransomware attacks, and honestly, a complete lack of emotional tone. True empathy just rarely translates well through a text message.
The pandemic, as we all know, forced a crisis response that triggered an absolute telemedicine boom. It quickly became the mainstream, totally normal way to manage chronic issues like asthma and COPD, and it did a great job reducing virus exposure. But it also exposed some really harsh realities. This rapid tech shift actually widened the gap of digital access inequality. Patients with lower digital literacy or those restricted by income, geography, or language suddenly found themselves struggling to access the very systems that were supposedly designed to make healthcare easier to get.
And so, that brings us to the ultimate crossroads of modern medicine. As technology and globalization completely redefine the healthcare landscape, how do we balance this incredible high-tech, remote efficiency with the deeply human empathy that is required to truly heal? It's a huge question, and it's a challenge every single healthcare professional and patient will have to navigate in the coming years. Think about it next time you're at the doctor's office or logging into a telehealth portal. Thank you so much for joining me on this explainer, and I'll see you all next time.